Welcome everyone to the Bent by Knowledge podcast, where we will dig into what current research and the Bible actually have to say about exercise and good nutrition. Well, welcome back everybody. I am excited to be here today and reconnecting with someone from my network. We'll get into that in a second, but today we have Sam Kramer, who is a registered dietitian amongst a ton of other hats. He'll get into that in a second, but we're gonna mostly go over today industry and regulations around the supplement world, which is sort of a hot topic. And this is gonna be episode 1 of a 2-part series. And next time we'll talk about some of the trends that we saw in 2020 and some of the supplement trends that we're gonna see in 2021. So I am beyond excited. And I would love, Sam, if you would introduce yourself, anything that you can think of, education, literally the reason that you're here, all the credentials that you can list.
Sure. Yeah. Thanks, Britt. Thanks for having me. It's great to be here. I'm excited to talk about this topic that is obviously a big part of my life. And I think, we're going to cover a lot of interesting things. So I hope everybody's really excited. So a little bit about myself. As you mentioned, I'm a registered dietitian. So licensed to practice nutrition, and originally had a really deep focus in performance and sports nutrition. That's what I studied in most of my academic career. I did my undergrad in nutrition at Rutgers University in New Jersey. I did my master's at Florida State, where you and I met. And then I also did my dietetic internship there. And then I was also working on my doctorate at University of Georgia. But then realized that I wanted to really be in the industry. So I've worked for a variety of different types of companies throughout the dietary supplement industry. Thing from very small startups on the e-commerce Amazon type platforms to extremely large food, drug, mass retailer type companies like Kroger, which is the second largest grocery in America. Mm-hmm. And currently, I'm the senior manager of new product innovation for International Vitamin Corporation, which is the manufacturing side of product development. So we develop a lot of products for the large food, drug, mass retail space like Walmart, Costco, Walgreens, as well as GNC. So have a pretty broad expertise throughout the dietary supplement world. I'm also Six Sigma Green Belt certified, which is essentially statistical control of different processes throughout the workplace to make them really efficient. So using a lot of math and really boring type stuff to things super efficient. And I'm also a certified sports nutritionist through the International Society of Sports Nutrition, which is kind of an onus to my sports nutrition background.
My goodness. Yeah. A professional in the field for sure. I mean, to say the least. That's awesome. Yeah. I know when we worked together at Florida State, we worked in a lab that was very sports nutrition and performance nutrition based, which was cool. I mean, we had a lot of industry funding from places like Dymatize and working with protein and working with pre-workout supplements and all kinds of things. And now you're more now broad supplements, right? So the company that you work for does a whole array of supplements. Is that what you're saying?
Correct. Yeah. So we formulate pretty much across every dietary supplement category you could think of. We do some sports nutrition and pre-workouts, protein powders, but we focus more on the mass. So we do your kind of what I call the foundation nutrients like probiotics and multivitamins, fiber powders, to gummies and soft gels and tablets across the more targeted areas like cognition, immunity, sleep, joint, you name it. We pretty much do everything except liquids.
Yeah. That's great. And so I really wanted to talk to you because I'm in a world right now where I coach fitness classes and I am a consultant for nutrition and for exercise. And I always have people talking to me about supplements, and I can tell them all up and down what research has to say about the effectiveness of supplements, but the background of it, the production side of it is a complete unknown beast to me. And I
Sure.
think that a lot of people would appreciate knowing how supplements are actually regulated, if they're regulated, and the development of them. Just to say that we trust this supplement the way that we would trust a drug that my doctor would give me. And so
Yeah.
I think
Go
that's an
ahead.
incredibly important process. What were you going to say?
I was just going to say, I think, there's a lot of miscommunication out there. I think even when you're in this world, it can be confusing because there's a lot of complexity, just like anything that you could, think of. But I think, also we didn't really learn about that in our formal education. I stumbled and fell my way into the dietary supplement world, and have been fortunate to be in it for a pretty good amount of time now. But I think there aren't academic channels to really understand how these things are made and all of the steps that companies have to go through to make a successful product.
Yeah. So I'm so happy to have you on board. But before we go any further and really dig into the weeds, can you just define for us what a dietary supplement is?
Sure. Yeah. So there is a formal definition, which is regulated by the FDA or the Food and Drug Administration. And it's a product that is taken by mouth. So it's an ingestible, and it can be a vitamin, a mineral, an amino acid, an herb, or a botanical or other ingredients like an enzyme that's meant to supplement the diet. And just kind of an extra note on that, we talk about how in the actual definition, it's meant to supplement the diet. It's not meant to substitute any normal food that would be in your diet. And when I was coming up through school and as a dietitian, there's kind of this credo of this like whole food first aspect where you need to consume all of your nutrients. And then if there are, gaps or something like that, you would go to a supplement. And I think that's true up to a certain point. I think being in this world, I've changed my philosophy and taken somewhat of a different position because sometimes it's either very challenging to get a required nutrient if you have some kind of contradiction or a lifestyle change like vegetarian or vegan. You have to supplement B12 and omega-3 fatty acids because they're either non-existent or very low conversion or bioavailability or absorption in the body. Or sometimes the required amount may just be challenging to get through your food sources. So sometimes like protein, which is a very classic dietary supplement, particularly for athletes or even older people who don't make or absorb protein as well as younger or healthier counterparts, sometimes eating that required amount of food is really challenging because protein is very satiating. It's the most satiating macronutrient. So when you're able to consume a protein powder that is, and in theory you could add other things to make it even more calorically or nutrient dense, you're able to get the required amount of nutrients in a very convenient way without sacrificing volume that normal food substances may have. And then I think also just people think of protein as a dietary supplement, which legally it is, but it actually comes from food sources. Whey and casein comes from milk. You can have other animal sources like eggs or what have you, and then you can have your plant-based sources too. So a little bit of a nuanced language there because it really is a whole food, just a byproduct.
Right. Yeah. I like what you said there too, that supplements are designed to supplement your diet. And I think that is definitely an area that's misconstrued, especially in women that are prone to dieting and things like that. They want to, what can I use to replace my diet or to replace a meal in my diet. And so I think it's really important to understand that supplements are just designed to, I like to say, cover your bases. So it's like you might be on first and second, but we got to get all the bases covered. And I love a multivitamin because it's like the best thing to cover your bases. And you just want to make sure that on top of what you're consuming in whole foods, you're getting whatever else you need in supplement fashion. And we can talk for days about the most common deficiencies in the United States, but I know something like vitamin D, about 80% of Americans are deficient in vitamin D. So we're not necessarily getting in our diet, or we're not doing the necessary things that we need to, like go outside and get it from the sun. And so it's really important that we're aware of what we need, and we're getting the clinical stuff done to determine what we actually are deficient in, so that we can come up with a plan for supplementing. So I really like that.
Exactly. The new dietary guidelines for Americans just came out maybe last week, a couple of days ago, for 2020 through 2025. And if you look through the data, a lot of really just all types of people across the lifespan are deficient in a lot of key, not just your typical macronutrients that I think we tend to focus on, but also a lot of your micronutrients and vitamins and minerals. So, having a multi, I think is just important, like you said, to, make sure that you have everything covered. And now I think the innovation in the dietary supplement space, which we'll get into, is just, it's so expansive. I think long gone are the days where you're taking these things that taste very metallic-y and it's a big horse pill. Now you could take gummies and it's like you're getting, functional candy. It doesn't get much better than that. So, I think that innovation is driving a lot of consumer acceptance and feasibility to find something that's effective and something that you actually want to take, rather than just it's another pill that you have to take that isn't fun.
Yeah. Yep. That's so funny. Yeah. I remember the days of the Flintstone multivitamin, the best.
Yep.
So knowing the definition of dietary supplements now, are there different categories or types of dietary supplements out there?
Yeah, so there definitely are. So like I kind of alluded to before, I tend to separate dietary supplements into two primary buckets, where you have your foundational nutrients. So these are either products or nutrients that people are typically deficient in, that are kind of everyday essentials, or they're not consuming enough of, whether it's they're not eating enough of it, or it's not absorbed very well. So like your traditional multivitamins, probiotics and prebiotics are a huge one, especially now that we're starting to see a lot of innovation and specificity within the probiotics in terms of dosing and strains. And we can talk about, that I think is a pretty big one too, that we can get into. Also, your traditional vitamins like vitamin D and calcium and vitamin C. Protein can be bucketed in there too. And then you have this kind of other landscape of your more targeted nutrients. So this would be ingredients that could focus on a particular area of the body, whether it's cognition, joint, brain, immunity, sleep, where you're taking ingredients that focus on a specific category or targeted function.
Awesome. All right. So now that we got the definitions out of the way, I do know that the process of creating a good supplement, and much like a ton of other things, takes a lot of time, energy, effort, finances, and there are tons of loops to get through. So I would love to go through the main steps of creating a supplement and manufacturing it from conception to launch. And I think the first place to start is idea generation. So just like anything else, you have to have an idea to start. Can you talk a little bit about that process in the beginning, or at least just the beginning process of creating a supplement?
Yeah, I mean, the ideas come from a lot of different places. And I think, there are definitely different swim lanes that you can pull data from or experience from and utilize, those that expertise. But I think a couple of the different things would obviously be market trends. What's popular in the market? Is there a new category like CBD that's exploded over the past couple of years that people are innovating in? Or is there a change in the landscape that would drive innovation? So COVID, for example, kind of changed the game of dietary supplements, where it really boosted sleep, immune health, and stress. And so we're starting to see not just you are seeing your general ingredients that are classic for these immune-based ingredients, like let's just say vitamin D and vitamin C, that I think people are very common understanding, or they have that understanding. But you're seeing a lot of innovation in those ingredients, like beta glucans and different probiotic strains that can actually target specific areas within the immune system. So upper respiratory tract, lower respiratory tract, sinuses, things like of that nature. So you're seeing a lot of innovation being driven due to COVID, which is for better or worse, or for lack of a better term, very exciting. Obviously it's been a challenging time, but
yeah.
A positive spin that has come out of it is you're seeing a lot of research and ingredients coming out to support immune health, which is great. So, definitely the market is important. You're also looking at research in terms of innovation and what's hot and what's new in terms of ingredients. Is there a new ingredient out there for immune health that nobody else has that you want to get your hands on first? I think, and then last would be, using a clinical brain, being a dietitian, having that, or, anybody else on your team that has a professional background in the medical space, working together to come up with a formula that is driving human health and, supporting public health and public safety in these times. You're using all of your different expertises to create a product in mind that has clinical and a ethical and clinical efficacy.
Yeah, definitely ethical significance. It seems like it's almost like you have to keep up with the Joneses. So you mentioned CBD oil, which is huge. I think with all the stuff going on with legalization of those things, I think that market has exploded. And so from supplement company to supplement company, it's like you have to keep up with your competitors. And so you have to generate those ideas and how, like you said multiple times, how can I be innovative and using this same thing like CBD?
Yep.
So yeah, definitely keeping up with Joneses. But after you create this idea, then you have to screen the ideas to see what is a good idea, maybe what's not a good idea, what's feasible. So what can you do, and what's non-viable, which is what's not practical. So can you talk about some of the steps for idea screening?
Yeah, so formally you do what's called a SWOT analysis, SWOT. This is one of those nerdy Six Sigma things that you can take and implement. But essentially, it's an acronym, and it stands for strengths, weaknesses, opportunities, and threats. So you're able to essentially get a very bird's eye view of this product that you're thinking of creating, and saying, okay, what are the benefits? What are the weaknesses? Where's the white space where there are gaps, either in the actual space on the market, and then the threats. Are there, perhaps it's an oversaturated category. Everybody and their mom has a probiotic supplement. How do you differentiate yours? But then once you kind of work on that, then you have to think about, okay, what's your end goal? Who's your end customer? Because depending on where you are in the supply process of product development, like, currently I'm on the manufacturing side, but I've been on the retailer side. So, and I've done both e-commerce and retail. So the actual customer is really going to be the primary driver pulling that demand for that product. So just as an example, a retail shopper at a grocery store is usually probably only going to be looking for your, kind of general run-of-the-mill dietary supplements, maybe a probiotic and a multivitamin, maybe some gummies for sleep stuff. Nothing that's super innovative. Whereas e-commerce, that's where you tend to see your very brand loyal customer that's looking for the innovative type products. You have a lot more market copy to kind of explain your product on a web page versus, you know, your tiny little space on a shelf. So I think, you know, when you're trying to screen this idea, you always have that end customer in mind and say, okay, is this product going to make sense for that customer? And then also price. Price is like probably the biggest thing, because I could have the best product in the world, but if it's $80 for a 30-day supply, nobody's going to buy it. You know, I'm just going to, you know, if it's this amazing sleep product that guarantees you're going to sleep every, you know, beautifully for the rest of your life, they'll probably just pick up a $5 melatonin and call it a day. So
Yep.
You're teetering that line of innovation and price and making sure that the customer will actually purchase the product.
Yeah, so much to think about. But I like what you said about the customer is the first thing that you need to think about, which makes sense because that's where you're
Yep.
pulling in the money. So so you finally have this idea, but an idea is just a mental construct. So we have to turn this idea into a concept, which is something that, it's basically an idea that's gone through a rigorous process to make a presentable version of what you want to do. So can you explain the step from going from an idea to a concept and what you need to do there?
Yeah, so typically we'll gather, let's say I have an idea for a sleep product, and you know, I'm gonna scavenge my ingredient database and put all these things together, and maybe there's a new ingredient that I want to introduce that has clinical research behind it, which would validate our claims. Maybe we can get a newer claim that is kind of novel within the sleep space. So we'll actually validate all that clinical research. That's typically my main role, is, you know, kind of being that scientific liaison and validating the actual clinical research behind the ingredients. So once you've gathered what we call a substantiation dossier, which is essentially validating that clinical research, we work with our ingredient supplier partners who actually own the ingredients, and we work with them on pricing and lead times and samples to actually make the product, and what it's called pilot testing. So you're actually in the lab on a bench top, and you're mixing these ingredients together, and you're putting it, whether it's a gummy or a tablet or a soft gel, which would basically depend on the type of ingredient that you have. You're working with those very interdisciplinary teams to make the product successful. And then you're also looking at the market, and you're still looking to see, you know, is there competition out there? Do they have very similar formulas? What claims are they making? What's their price? So you're always benchmarking against what's on the market. So if you're first to market, you have to be very careful, because you don't want to be, you know, you don't want to be super overpriced and then somebody else come in with the same formula and, you know, basically have a cheaper price. So
Yeah.
you do all these things. And while you're doing all that, you're building, at least in my end of manufacturing, you're building your presentation for your customers. So you're making sure that you have, you're essentially typically almost a year and a half away from actually when you launch the product. You're starting about a year and a half to 2 years in advance. So as an example, we're in January of 2021, and I've been working on my 2022 pipeline since March-ish of last year of 2020. So
that should make you feel good as a consumer, though. Like, I didn't even know that it took that long, because you mentioned a bunch of things there, but it all just made me think of research. And so I think that, I mean, you talked about the bench top, you talked about all this other research liaison, which is like a hot topic in the PhD world these days, because not many people want to go the research route, but they want to go this route where they can still talk research. And a research liaison is the person that can go between research and industry and be able to crosstalk, sort of. And It's so important, and it should make you feel good as a consumer that you have people that understand and know the research to be able to communicate that to industry, so you know you're getting the best version of the product.
Exactly, because it can kind of depend on again where you are in the supply chain and how big of a a retailer or a manufacturer you are. Sometimes these companies have teams that are dedicated to the research, and sometimes they don't. It kind of depends. But yeah, I think it's obviously super important because and we haven't even talked about the quality and the regulatory step, which so we're doing all this stuff as a product development team. Then you have these other teams that are also kind of acting as your checks and balances. You have legal, regulatory, quality, that are also checking the more technical side of things and the legal status of all these things that you're trying to do as that pipeline goes on. So yeah, so a full development of a product takes about a year because you're doing all of these, these steps to ensure that you have not just a safe and legal product, but also making sure that it tastes good and that it gets delivered on time, and all these other elements that people don't really think about.
Yeah, yeah. How interesting that it takes that long. It reminds me of the COVID vaccine. We won't get into it, but people talk about how
Yeah,
long it takes to develop a vaccine. And I'm like, well, if you have a significant demand, it shouldn't take 5 years. But
exactly.
anyway, so now you have a concept and we have to start playing around with the market, and you have to develop a strategy to be able to work the market really. So can you talk about the
Sure.
market strategy development step a bit?
Yeah, so this is typically done with multiple teams. Like my team, like product development, we have a hand in it, obviously, in more of the initial stages of the claims and the substantiation and things like that. And in my career, I've touched on other elements, especially on the retail side, where you're suggesting pricing and you can talk about different pricing promotions. Maybe you'll see if you go into a Walmart or whatever, you see everyday low price. You'll see buy one, get one free, buy one, get one half off, all these different pricing promotions that would, incentivize a customer to purchase that product. So, other market type channels that the marketing team would typically handle would be you can have end caps on the store. So like where your product, this is more for retail, because if you look at it's formally called a planogram, which is basically the layout of the supplements on the retail shelf. It's like you get maybe 16 feet, which is a 4x4. So you don't get a lot of space essentially to list all these products, and you can get inundated with all these different selections. Like everybody's got a melatonin gummy. How do you pick the best one? So end caps and signage essentially bring that product out to the front of the shelf. So you'll see at the end of the aisle, you'll see like sometimes it's like a shelf that's sticking on the outside of the shelf or like a little rotator. And so the product is essentially brought out for the customer to say, oh, I don't need to go search 40 different kinds of melatonin. I'll just pick this one right here that's already sticking out. So different things like that. That's more of like a pay to play service. So like brands will pay the retailer to actually put their products further out. That's kind of part of their marketing budget or their marketing spend. But other like common things would obviously be social media. That's huge with the Instagram influencers and professional athletes and things like that. That's obviously driving a lot of sales as well.
Yeah. So again, it's like keeping up with the Joneses. You gotta
Yeah.
you gotta make sure that you're one step ahead and knowing how marketing is changing. And you mentioned social media. I mean, marketing has expanded so much. I mean, I think about it. There are literally career positions for social media managers, and
Yeah.
I don't know if do you have any in your company?
In the past, I have in my career on the retail side. Yep, social media managers and whole teams that are exclusively. They have their own programs that look at basically SEO or search engine optimization. To boost products up, and especially on the e-commerce Amazon type channels and things like that. Yeah, definitely.
Yeah. I mean, my feed is infiltrated with protein.
Yeah.
So they
Well,
know what they're doing.
It's so funny you say that because like I'm on my work laptop right now, and because I'm constantly searching supplements for work, like I just get, flooded with every kind of, supplement you could think of the day. So it's just kind of funny, the targeted ads.
Yeah. Yeah. Oh my gosh. Interesting world. So the next step is business analysis, which is the business aspect of a new product, where the business aspect of a new product is analyzed. So can you talk about this step a little bit?
Yeah, and I'll try to not get too granular because it could be super boring.
Yeah.
But
Make
essentially,
me understand.
yeah, and I'm happy to explain it. But essentially, what you're doing at this step is you're asking yourself, is this product worth it? Is it worth to sell? Is it worth to make? If you're the manufacturer, are we producing enough units to be profitable? Because if you think about it from the manufacturing side, if you work with a very small retailer and they're only going to produce 5,000 units per year, you have to think about it from the manufacturing side where they have to, after that 5,000 units, shut down, clean the machines, the labor costs, the operating costs, packaging has to be switched. If you have like graphic design, that's a cost that gets incurred. So a lot of manufacturers have trouble with these kind of smaller supplement companies that are kind of fly by night that just want to do a quick run, whereas a lot of them want to work with like the big players because they have hundreds and thousands of units and they can kind of streamline all their processes. And some manufacturers will work with small companies. That's like their jam. But a lot of manufacturers like the big run players. So essentially, you're trying to understand if you're profitable. So the manufacturer and the retailer will essentially work out. Let's say a product's going to sell for $20. Out of that $20, you essentially work backwards from each stage of the product development process of retailer and manufacturer, and you say, what am I going to make out of that $20? Is the manufacturer going to make $5, $10? So you're kind of working with your customers to come up with a solid margin of profit based on that $20 example.
Yeah. Interesting and important for sure. But then the next step is the fun step. From what I understand, it's the product development. So you've taken all of the steps we just talked about, and you're finally able to play around in the lab and develop a product. Can you talk about that step?
Oh yeah. I mean, this is where you're taking your theory and it's, taking paper to practice, right? You had this idea in your head and you did all this work to, understand the research and the claims and your forecast analysis, and you're working with your ingredient suppliers and your customers and saying, okay, this is going to actually happen. And the customer places an order, and well, actually, no, I'm sorry. This is still prior to customer placing an order. I'm getting ahead of myself because I'm getting essentially you're creating samples of the product. So it's your initial first step to having something that's tangible. And sometimes it's fun where it tastes really good, and other times it's really gross. I've tasted a lot of things that you think are going to taste really good, and they end up tasting really slimy and off-putting. But that's like part of the game, right? Like I was working, just as a fun example, I was working on a fiber product, and I had to like get other fiber samples. So I walked out of Walmart with like 16 cans of fiber, and I have to try all of them. So like I'm evaluating like 20 fiber samples, and it's like at some point, they all taste like orange, it's like noticing any delineation. But but you're creating this product, and you're also doing your quality and your regulatory assessment, which is obviously a very critical step, which I think this is where the dietary supplement industry gets a bad rep. And we'll talk about, I guess, what that quality and regulatory steps look like, but you are performing that at this stage, or even beforehand, if you have, if you kind of know and you have all your documentation. So yeah, this is, in in my opinion, the most fun step, because you're actually tasting things that are hopefully good.
Yeah, yeah. And it does sound fun. It sounds like a whole lot of food science, which I don't think people understand as an actual field. Food science is it's like crafting food and how to store food and
Yeah, the sensory evaluation training, food safety. When you're creating a product that is very sensory heavy, like a gummy or a powder, all the different sweeteners and texture modifiers, and if you're going natural versus artificial, and even gummies, pectin versus gelatin, and the stability and quality of all these things. It's a whole different beast.
yeah,
Nutrition.
Science, love it.
Yeah.
So to this point, in doing all those first steps and getting to the creating the product, how long is that?
So from conception to this point, probably like 4 months or so, 4 or 5 months. Yeah. So, the toughest part of where we've gotten up to is really gathering documentation, because you're relying on external, feedback, and then that obviously has to be reviewed and approved. So that can just, take a little bit of time.
Mm-hmm. And can I ask too, you said creating samples, is that just for the scientists to try out, or the people within your industry, or is that something that you're actually sending to market to like a GNC?
Yeah, so this is, typically it's just internal, where it'll be like the R&D team, product innovation. When I was with Kroger, we do what's called formal cutting. So you actually have like outside test group people come in, and you have sensory training, and it's a very, very formal process, where they're essentially evaluating all these different aspects of the product. But in more of a more common industry practice, it's more internal. And then those samples, when you see like individual samples at GNC, those are typically taken from, still your very final bulk production, because you're working out the kinks at this stage.
Interesting that there's teams that are trained with that stuff, which makes sense. I feel like I've seen movies or something where people were trained to taste ice creams, like different ice creams. It was strange, but
and I was going to say, you also kind of learn a lot about yourself too. Like you learn what you're very sensitive to. Some people have like the super tasters and stuff like that. But like I'm very sensitive to stevia, so like if I taste something with stevia, I know it's in there like immediately. I get that aren't bitter back end taste. Yeah.
So funny. So one of the last steps is commercialization. So now we have developed a product after all that time, and we have to introduce it into the market. So can you talk a little bit about that process?
Yeah, I mean, it kind of depends on your end customer, like we talked about before. Like, are you more on the retail side, or are you more e-commerce and Amazon? I mentioned a little bit where, like, if you're just starting out and you have a super innovative product, you may want to do more e-commerce channel, the online platform, because that's kind of the home for that more innovative platform. You could be more expansive on your copy, whereas it's very challenging to get into the retail space because you're restricted to that tiny planogram, so you have a limited amount of space there. But typically on more on the retail side, especially if it's brand new, most companies will start small with kind of like a pilot run distribution. Let's say there's 300 stores total, maybe they'll do 20 or 40 the first run, and if it does well, then they'll pick up expansion distribution, and then go from there. Whereas e-commerce, you can pretty much launch anything on Amazon, but there are also dedicated companies like let's say Swanson or iHerb that is, they are dedicated e-commerce platforms, but for other brands beyond their own actual private label brand.
Interesting. So that is top to bottom with how supplements are created. And I mean, that's so layered. And I can imagine that the team is huge. And like you said, it takes about 1.5 to 2 years. So that's incredible and so intricate. But the next part that I wanted to talk about is regulation. And I want to talk about this really because of selfish desires of learning. But
Sure.
regulation of supplements is so interesting. And I feel like I've been jaded by it being in research with sports supplements, because you do see so many sports supplement companies that have tainted products. They'll go and, you know, when you do research, you have to do third-party testing where you actually see what's in the supplement, and what they claim is in the supplement isn't in the supplement. And so we have this world, this supplement world, where you have good guys and bad guys, so to speak. So they're the people that follow the rules and the people that don't. So I think it's really, really important to talk about regulations so that, you know, when you're looking at a product, you're looking for a specific company that really knows what they're doing and is ethical in their practices.
For sure.
And so with that in mind, are supplements regulated? And if so, who is doing the regulation, and to what extent are they actually being regulated?
Yeah. So yes, they are regulated.
Yay.
Yeah, right. It's a good thing. Yeah, I think there tends to be this misconception that dietary supplements are this Wild West, and, you know, people are putting whatever they want in there. And, you know, unfortunately, like you said, there are bad players. You know, I tend to, and obviously, you know, I have a slight bias because I'm in this world, but because I'm in this world, I have a very, you know, kind of nose close to the ground understanding and seeing where the industry is going to. So to kind of pull back and answer your question, and you know, kind of talk about where the industry is going, I think, you know, so first and foremost, dietary supplements are regulated by the FDA and the FTC. The Food and Drug Administration and the Federal Trade Commission. So the FDA is largely responsible for the actual dietary supplement itself, in terms of any kind of adulteration or quality, or anything that's kind of related to the actual product itself. The FTC, on the other hand, is more interstate commerce, as well as claims. And the FDA also regulates claims. Like, you'll see FDA warning letters go out to companies that are making, you know, the claims that are focusing on disease, which you're not allowed to do. That's like Formulation 101 for dietary supplements. But the actual governing act for dietary supplements is called the Dietary Supplement Health and Education Act, or DSHEA. Essentially, so we'll pause here for a second because I just want to make sure that I'm okay. We're back on. So in addition to DSHEA, there is this growing self-regulation interest within the industry. So there are groups like the CRN, which is Council for Responsible Nutrition, or APA, which is the American Pharmaceutical and Herbal Botanical Council of America. They're essentially pushing for this self-regulation, because the FDA is a big organization and they are notoriously known for being very slow and not really, they're not very proactive. They're very reactive to any kind of, you know, any kind of adulteration or you know, any kind of or foul play, I should say, within the dietary supplement industry. So the CRN has really worked really hard to create what's called the OWL. It's like an online wellness library. So essentially a library of products that get essentially pre-market approval, because part of the reason why dietary supplements get such a bad rap is because there's no pre-market approval for the product itself. So anybody in theory can put a product on the market as a dietary supplement without the FDA formal seal of approval, whereas a drug, you have to go through the proper channels to get, FDA approval. So that's where you start to see that line of differentiation. However, dietary supplements are regulated just like food. So people don't know that you actually, it's the same thing as food, where there's no pre-market approval for food. So dietary supplements and food are the same.
Huh.
Yeah, super interesting.
That's really interesting. And that's what I was going to ask you. So like today, if I made a supplement, I can sell it to GNC without.
So you can sell it to GNC in theory without FDA approval. However, you do have to submit all of your claims to the FDA that you're making on the product prior to launch. And every ingredient within the product is approved by the FDA. So let's say I have a 3-ingredient formula for sleep. Every ingredient in that product has what's called a regulatory status, whether it's GRAS, generally recognized as safe. It's a new dietary ingredient, which you do have to submit an application to the FDA, and they essentially have to have no objections. It can be an old dietary ingredient, which means it's been used for thousands of years, like salt or caffeine or, something like that nobody, there's been no issues, or food grade, that it's been in the food supply prior to a certain date that was back in, I think, 1954. So that's kind of the big misconception there, where, people think that there's no regulation, but it's actually quite heavily regulated between the dietary status of all the ingredients, these kind of industry trade groups that are pushing for this self-regulation and improvement in quality and regulatory. And then the FDA is actually really starting to crack down pretty heavily on these companies that are not being ethical. Over the past probably 5 years, the FDA has finally taken companies to court and have started seizing assets and
Wow.
imposing heavy fines and even jail time, depending on the severity of what they're doing. There's companies that have been, I won't say the actual companies, but there have been companies that have been brought to litigation for, putting banned substances in their products and, essentially interstate commerce of steroids and all these other things. So, I think while there isn't this pre-market approval, which I think that probably should change, and there is talk of this, this update of the Dietary Supplement Health and Education Act, kind of a 2.0 version, which might have pre-market approval. I think there's a lot of good things happening in the industry between the FDA, the FTC, and these industry trade groups that are pushing for a more, tightly regulated industry.
Yeah, that's great. It's great to know. So can you just confirm, like, let's say I have a supplement, it has something that's going to boost testosterone and I have that as a claim. So I have to submit that to the FDA. And
Correct.
What if they do their research and things don't match up?
So they will tell you, they will say, per whatever law, this is not allowed. Maybe you didn't provide substantiation. Maybe you also have to provide the regulatory status. So they will, they'll send a letter of rejection or what have you.
Yeah. Interesting. That's good to know. Definitely good to know. So we should then be able to trust the labels for the most part. Like,
yeah, I would hope so. So you can have your, like, I think you mentioned the different third-party certifications. And this is more the sports nutrition gear. There's NSF, there's Informed Choice, BSCG. There's a couple others out there that essentially, guarantees that what's on the bottle is in there. There's no banned substances, etc. But those are pretty expensive. A lot of companies don't want to pay for that when they're already doing quality and regulatory, control. So how do you pass that transparency along to the customer? Is kind of challenging. I think if you don't have that third party cert, but I don't think just because it doesn't have the third party certification doesn't mean that it's a bad product. Kind of this, like very similar to like a cost and quality product. Like just because something is really expensive doesn't mean that it's the best product in the world. And just because something is really cheap doesn't mean that it's not good. I think just, trying to understand as a consumer, if you're looking at a product, what the efficacious dose is, and if it's a standardized ingredient, is it standardized to the right type of compound and the right dose, and things like that can, definitely help you choose a product.
Yeah, for sure. So many things to think about. But speaking of trusting what's on the label, sometimes it's difficult. And of course, I always look through things with the performance nutrition and performance supplement lens, but there are these things called proprietary blends, and I know you'll explain it in a second, but they can be misleading because it just gives you something like muscle pump blend, and it'll list a couple things under it, but it gives you the overall total of what's in that blend, not each respective ingredient. So can you talk about that a little bit?
Yes, you are absolutely correct. A proprietary blend is a blend where you list the total amount or the weight of the blend, but not the actual individual ingredients. So this is very old school. I think again, this kind of industry tide is changing, and the proprietary blends are definitely going away. And companies are being more transparent and breaking out those blends and saying you're getting X amount of you're getting 6 grams of citrulline and all these other vasopump type ingredients. So it's kind of a thing of the past. So I would try to avoid them as much as possible, because like you mentioned, because you're only getting the total weight of the blend itself, you don't know if you're getting the efficacious dose, and you're typically not. Of these blends. Like I'll see a blend that has maybe the whole thing is 5 grams and there's citrulline in there, and that you need 6, even upwards of 8 grams worth of just citrulline. So it's like I already know that it's bogus because you're not getting enough of one ingredient, and the blend is 8 ingredients.
Yes.
So excuse me. So I think it's a negative thing to have a blend for that reason. But then also it can be dangerous too, because if there's caffeine in there and it doesn't list how much caffeine is in the actual blend, you could be taking 400 milligrams, you could be taking 10 milligrams. Who knows? It's a dangerous world.
But they sure know how to market those proprietary blends. So I'm really happy that the market is going away from that, because I know, of course, again, I'm talking about performance nutrition and supplements, is that people that are interested in exercise love to see like muscle pump blend and vascular blend and all kinds of things. So it's really good that they're getting away.
And I'm sure we'll talk more about the sports nutrition world in our trends session, so that'll be good.
Yeah, for sure. So jumping back a little bit to claims, and when we say claims, we're saying what that product is claiming that it does. Mm-hmm. And so there are 3 types of claims from what I understand in the supplement world. Maybe we can speak to other ones. There's the nutrient content claim, the health claim, and then the structure and function claim. And they all have different there are different rationales for being in there. So can you talk to each of those 3?
Yeah. So nutrient content claims you don't see too much in dietary supplements. Really, this is more designated for food. You'll see it on dietary supplements that have calories, like a protein or a meal replacement or something like that. But essentially, nutrient content claim is talking about the actual nutrients in the product, and these have very specific definitions outlined by the FDA. So this would be things like low fat, low sodium, reduced calories, and they all have actual formal definitions. So a low fat is less than 5 grams of fat per serving. So you have to basically be within those guidelines. So for a more like a botanical or something like that, an ashwagandha or something that doesn't have calories or anything, you wouldn't see a nutrient content claim.
Mm-hmm.
A qualified health claim, also very rare, pretty much across the board. You really only see this for a couple of nutrients. Essentially, this is a health claim that allows foods or dietary supplements to talk about the mitigation of disease. It has to be approved by the FDA, by tons of research and panels, and it's very challenging to get a qualified health claim. So, for example, one just came out for cranberry extract about a month and a half or 2 months ago, talking about how cranberry extract at a certain dosage can reduce the risk for urinary tract infections.
Wow, about time.
Yep. Yeah. Another one would be the omega-3s can reduce the risk for cardiovascular disease, but you have to meet a certain threshold of the omega-3s. So very rare, but they are out there. The last, as you mentioned, is structure function claim, which is very omnipresent in dietary supplements. Essentially, it's talking about how the ingredient plays a role in the body. However, structure function claims can't talk about how a product mitigates, treats, prevents, or cures a disease or anything like that. So that's why the FDA sends warning letters, because companies, especially with the CBD world, they're going crazy and people are talking about how they mitigate, all these different types of ailments. What's interesting though is that companies are also responsible for their social media platform. So if a customer places a review and says, this product treated my cancer, the company's responsible for that, even though somebody else posted it to their site. So something to be wary of if you're out there thinking about doing dietary supplements. Make sure you monitor your social media platforms.
Yeah, well, that's good to know too, because I mean, keep it clean, right? Because people make claims on everything. I think it's interesting too, because people will make a claim that, like you said, this supplement leads to this, but they don't talk about anything else they do in their life. So it's like you have to be mindful as a consumer to really do your actual research and don't pay attention to the pagans. Know what you're looking at. Yeah. So standardization is something that's interesting too. It's a process that where some dietary supplement manufacturers will make sure that each batch of the product is the same as far as dose and quality, which is really important, because I mean, if you're producing a product over the course of 2 years and I'm consistently taking that product, I want to make sure that I'm getting the same thing, let's say every time I take it. So can you explain a little bit more about this process and maybe if it's regulated and to what extent it's regulated?
Yeah, so this is where the quality review comes in, and the samples too, because those samples that we create, you're essentially doing real time and expedited stability. So you're making sure this is huge with probiotics, because you'll see, CFUs, colony forming units, is the active bacterial count for the actual live probiotic strain. So a lot of companies will list at time of manufacture. And let's say the dose is 10 billion CFU at time of manufacture. In the old days, you wouldn't know how many active cells you're getting at the end of expiration. So if you're using that bottle every day and you're opening the bottle and exposing the live bacteria to heat and humidity and light and all these things that can impact stability, you might not have any active cells by the time you're at the end of your expiration. So now the industry is changing to where CFUs should be listed at time of expiration. So that's why the stability is all that more important, because you're guaranteeing that potency through the entire shelf life.
Yeah, so important, and glad to hear that that's regulated for sure.
There's it's called USP, or the US Pharmacopoeia, which is it's called a monograph. It's essentially this I don't know what you like a rule book that dictates, in order to be called turmeric, it has to be the standardization has to be between this range and this range of curcuminoids, which is the active in turmeric. So there's a very detailed outline of, how you call something turmeric. How do you, how are you legally able to be called a turmeric? And typically it's validated through lab testing and documentation that you receive from your ingredient suppliers, and that gets passed through to the retailer. So everybody's on board with that. But yeah, just got to make sure that what you're getting on paper is actually what it says. So that's why, doing that quality testing is important, because if you test for it and, with the turmeric, if you're under curcuminoids, then it's not what it says it is. So you have to go back and, get a better batch or go to a different supplier. So it's
yeah. Awesome. And the last thing that we're going to touch on in this section is the enforcement of all the stuff that we talked about. So there is both civil and criminal enforcement options if anything goes awry. And there are a couple ways that things can go awry. So I would love if you could talk about some of the main issues and where things would have to be enforced if that were needed.
Yeah, this is definitely not my area of expertise, but definitely have, at least a basic understanding. Essentially, you have to, you can't be misleading to the customer. You have to say what your product is, and make sure that the potency is, what it says on the bottle, it's in the product. So that's where you see, especially like the mainstream media, they'll, like a Consumer Reports, they'll pick out like 30 CoQ10s and they'll test all the CoQ10s and test whether it's that potency that's on the label. So that's where you've seen some kind of mishap in the industry. The adulteration, we've seen a lot with like saw palmetto, which is typically for like men with like prostate health and urinary tract health. Where sometimes smarter people than me, unfortunately, can spike the colors of the plant to bring up like fatty acid and like different components of the plant. So they're basically spiking it with like fake dyes to adulterate the product. And we saw this with like protein a couple of years ago, where people were like nitrogen spiking, where essentially you're putting in cheap filler so when you test for amino acids with what's called PDCAS, it doesn't differentiate between amino acids and other nitrogen containing compounds. So companies were just putting in cheap fillers that had nitrogen content and claiming that the score that they got was equivalent to the protein, but it really wasn't, because it was just cheap filler. It wasn't actual amino acids. So that's where you start to see lawsuits and companies are misbranding. So essentially, you get taken to court, and like I mentioned, the FDA is really cracking down and now starting to seize assets and companies, I should say, pay assets back and even jail time if it's really bad. So definitely need to be scrutinous in this industry now that the tide is changing.
Yeah, a lot of things, and this area is really interesting, and I think you can get tripped up in a lot of cases. I mean, if, like you said, misbranding, adulteration, which I feel like happens a lot because there are a ton of ways where you can make a product cheaper to manufacture and just add things in there to bulk it up a little bit. And I am curious, where along the line are people caught up in that adulteration process? Is it like when they go to third-party testing, or?
Sometimes, yeah. I mean, if a product gets if it fails testing, typically you have to go back to the drawing board and say, okay, did we get this is me talking as the manufacturer. Did we get a bad batch from the ingredient supplier? Do we get another batch from them? Do we send it out to a different lab to have a second opinion? Do we go with a different supplier that we know of that has this ingredient that we're trying to find? So there are a couple different avenues, but I think the biggest thing for, people that are interested in industry is, don't always rely on the paper, because you'll get a certificate of analysis that says, this turmeric has 95% curcuminoids, but don't just accept that. It's like anything, don't accept anything at face value. It doesn't have to be industry, it could be anything in life. You have to test it yourself, you have to send it to a third-party lab, even though if it costs money, it's worth it, because the long-term repercussions are way worse than spending a couple of dollars on validating your product.
Yeah. And I think that's important at the industry level. I also think that's important as a consumer. I tell that to anybody that asks. I'm like, do your research, scrutinize the product, scrutinize the exercise program, whatever it is. Don't just trust. Scrutinize your own doctor. Tell the directions and the advice that your doctor gives you. Don't just take it for face value. You have to be able to do your own research. So important to be able to be a good consumer and not just a consumer.
Yep, absolutely.
Yeah. And another one too, and we brought up CBD a couple times. We'll talk about this a lot next week, but where you can't legally market it as a dietary supplement is another way where people get tripped up. So can you talk about that a little bit?
Yeah. So in 2018, the federal farm bill passed, which federally allowed the selling of hemp. And hemp is the crop where CBD is found. CBD is a cannabinoid, which is a non-psychoactive component of hemp that has been evidenced to show benefits, but we'll talk more about that in the next session. But essentially, so hemp is allowed to be sold federally, but really it's individual states that control hemp distribution. So your individual state where you live will say, yes, you can sell hemp, or no, you can't. Mm-hmm. With CBD, it used to be scheduled as a class 1 drug, which is up there with heroin and cocaine. The federal farm bill effectively decriminalized CBD. So now it is taken off the drug schedule. So people think that because it's not a class 1 drug anymore, that it can be sold anywhere. However, that drug class is regulated by the DEA, whereas the FDA controls dietary supplements, right? So different swim lanes. So in the eyes of the FDA, CBD is not legally a dietary supplement.
Wow.
Right. So a part of this is because really, in my mind, the biggest issue of why CBD has not been a dietary supplement is because we don't have long-term safety data in humans. Mm-hmm. And we've actually seen in animal models some liver toxicity at pretty normally physiological doses. So that's a risk for concern. And also, if a new drug application is submitted and passed, that effectively blocks it from ever being a dietary supplement. So if something is a pharmaceutical drug, it can't be a dietary supplement. And a couple of years ago, GW Pharmaceuticals got Epidiolex approved, which is a CBD isolate for seizures. So because CBD is now a drug, it really can't be a dietary supplement. But what industry is arguing is that, well, that's a CBD isolate. Maybe we say, okay, you can't use an isolate, but you can use, a full spectrum hemp or a broad spectrum hemp, which just has CBD in it, but it's not an isolate's a really high concentration. Uh-huh. So we haven't gotten there yet. There was a former FDA commissioner who was very pro CBD, and he was working with the industry to try and come up with a proper regulatory path. but he resigned, and there's a new FDA commissioner who's kind of on the opposite side of the spectrum. He's like, I want to see safety data. I want to see, all these things prior to us making a decision. So what's interesting though is that CBD's out there. It's a really big category. It's a couple $1 billion category, or projected to be that in the next couple of years.
Yeah.
The FDA isn't really cracking down on companies unless you're making a disease claim, which is, as we know, Formula 101, you don't make disease claims for dietary supplements. So it's this weird, I don't know, not cat and mouse, but companies are doing it anyway. And the FDA is kind of just letting it slide unless you're doing something really, egregious. So
yeah, which it's so funny because like you mentioned earlier on, it is I guess we will talk about this the next time, but people are linking CBD to a lot of their improvements in health. Like the classic is, I'm doing it for my glaucoma, or I'm doing it for all this stuff. Yeah. So
yeah, and I mean, and there's, so then you can even get a layer deeper, and you can look at the clinical research, and you can say, yeah, there's evidence out there, but the dose is at least 600 milligrams. And if you look at most products in the market, there's 600 milligrams per bottle. So you'd have to, a whole month's supply in one bottle.
Yeah.
So it's just not practical. So personally, I don't see CBD being passed as a dietary supplement, like a proper regulatory pathway, for a couple of years. Everyone's super optimistic about it, and I'm just like, I don't know. I think these companies that are making disease claims, they're kind of ruining it for everybody else, because the FDA is probably going to, in my mind, they're going to say, see, look, you guys, you're making disease claims anyway. What's going to stop you if we make it a proper regulatory path anyway?
Yeah.
But then also on the other side, it's well, there's all these companies that are coming out with CBD products and doing the wrong thing. But at least if we had some guidance to say, okay, you can only put, X amount of milligrams, or only this type of CBD. You can't use an isolate, but you can use something else. That would at least provide some guidance to, do something proper, because right now CBD is kind of the Wild West, and, people are doing whatever. It's you see one product with, 2,000 milligrams per bottle, and it's a tincture liquid, another one that's 500 milligrams and it's a gummy. It's how do you know what the right dose is? You just don't know.
You don't. So it is the Wild Wild West. So that's also interesting. But overall, it sounds like, and I'm happy that supplements are regulated, and the regulation process seems to continue to evolve and improve. And there are tons and tons of steps to conception to launch of a supplement, and you should be able to trust what's on the bottle. And so much good information, and I feel so much better about it. But much like any other industry, and we've touched on this too, there are good and bad guys. So for the normal person out there that doesn't know the ins and outs of the supplement industry, what would you recommend to them to be the best consumer? Like the one thing you would recommend?
Yeah. I think if you're going to try something, try and find, clinical research, look at PubMed, look at Google Scholar, try and find especially if it's a branded ingredient. So if there's a trademark out there on the actual bottle for that ingredient, look up that ingredient. Typically there's published research behind it. So, really you want to make sure as a consumer that you're not wasting your money, right? Money is precious, especially during COVID, but your health is important too. So if you're interested in dietary supplements, I think doing that research and making sure if it is a high priced product, make sure that it's worth it. Make sure that there's the proper dose. Make sure that you're not getting, what we call pixie dusted or fairy dusted, where you're just sprinkling a little bit in there, or salt bang, that you're just throwing in a couple milligrams of something when it needs to be hundreds of milligrams. I think that's the big thing. And then also look at look at the FDA website, and it can be inundating, but what you can do is you can type up FDA warning letters, and you can see if the FDA has issued any kind of warning letters for any kind of violation throughout history. So if you are interested in a particular brand, you can type in, brand X FDA warning letters and just see if they've ever been, if they've ever received anything like that, just to have a peace of mind that what you're doing is at least hasn't been, mandated by the FDA as doing something wrong.
Yeah, so important. And so you get a supplement, and of course you also want to, before making any major changes like that, consult your physician or a registered dietitian like yourself, because you don't want to get too much of a product or the wrong product, or combine that with something you're already taking and be at a really bad disadvantage. Like I remember one time I took, I think it was like double the scoop of a pre-workout, and I remember doing bench press, and I was like shaking, and I was like, I need to leave. That's it.
But you must have felt really good, at least.
I felt hyped up, but too hyped up.
Yeah.
So yeah, checking with a professional before you make any decision on your health is of utmost utmost importance after you do your research.
Absolutely.
Yeah. Well, Sam, it was incredible to talk to you, of course, and I am pumped up to talk about our next one, which is, like I mentioned before, trends from 2020 and how those trends are changing, or any new trends coming in the supplement world for 2021. So keeping people on their toes to see what they should be looking for in the supplement world.
Yeah, I'm excited too, and thanks for having me, and very much looking forward to part 2 as well.
Yeah, of course. Hey guys, I am so excited for my new book entitled Through His Strength by Improving Ours, Family, to be released on February 4th. This book has been strategically designed to educate parents and caretakers on what the Bible and research have to say about exercise and nutrition. And then after they soak in all that good information, they will rally the family troops and complete discussion questions and fun practical application activities. To learn more about my new book, visit my website at www.drbrittanyRallman.com. That's www.drbrittanyRallman.com.